As you approach 50, be mindful of potential health issues like heart disease, high blood pressure, diabetes, arthritis, osteoporosis, and mental health concerns, and prioritize regular checkups and healthy habits. Here is a more detailed look at common health issues that can emerge or worsen in your 50s. Cardiovascular health. Heart disease. The risk of heart disease, including heart attacks and strokes, increases as you age. High blood pressure. As arteries become stiffer with age, blood pressure can rise, increasing the risk of heart problems. High cholesterol. High cholesterol levels can lead to plaque buildup in arteries, further increasing the risk of heart disease. Musculoskeletal health. Osteoporosis. Bones naturally become weaker with age, increasing the risk of fractures. Osteoarthritis. Joint pain and stiffness can become more common as the cartilage in joints wears down. Diabetes. Type 2 diabetes. The risk of developing type 2 diabetes increases with age, especially if you're overweight or have a family history of the condition. Mental health. Depression and anxiety. Mood changes and mental health challenges can become more common as you navigate life transitions and aging. Menopause for women. Menopause can cause significant hormonal changes and lead to mood swings, hot flashes, and other symptoms. Other health concerns. Hearing loss. Hearing loss is a common age-related condition. Vision changes. As you age, you may experience changes in vision, such as needing glasses or developing cataracts. Weight gain. Metabolism slows down as you age, making it easier to gain weight. Cancer. The risk of developing certain types of cancer increases with age. Chronic obstructive pulmonary disease, COPD, a lung disease, is more common in older adults, particularly smokers. Taking action. Regular checkups. Schedule regular checkups with your doctor to monitor your health and address any potential problems early on. Healthy lifestyle. Adopt a healthy lifestyle that includes a balanced diet, regular exercise, and adequate sleep. Manage stress. Find healthy ways to manage stress, such as exercise, mindfulness, or spending time with loved ones. Stay active. Engage in regular physical activity to maintain your strength, balance, and overall health. Quit smoking. If you smoke, quitting is one of the best things you can do for your health. Maintain a healthy weight. Losing weight if you are overweight or obese can significantly improve your health and reduce the risk of chronic diseases. Get enough sleep. Aim for 7 to 8 hours of quality sleep each night. Stay socially connected. Maintain strong social connections with friends and family to combat loneliness and depression.